Hi everyone, I'm Dr. Tanya Manikkam and I work at NutriChem, and this week is Naturopathic Medicine Week. So I'm one of the naturopathic doctors here, and I was asked to talk about the thyroid. So the thyroid is one of my passions. I feel the thyroid is undertreated. So many people come in, they said, oh, I was diagnosed with hypothyroidism. I'm treated, I'm taking medication for it, but I still don't feel good. So not feeling well for these people, they tend to have low energy, their hair is still falling out, they're gaining weight still, or they can't lose weight. They might have a lot of joint pains, chronic joint pains, that kind of stuff. So I'm here because I want to talk to you about what you should be doing if you do suffer from thyroid issues. So the first thing we need to understand is that our medical system will test for something called TSH. Now, TSH is the hormone that your brain sends your thyroid to work, right? The higher this number, the less your thyroid actually works. So normal in Ontario, 0.35 to 5. If you go different places in the world, though, normal for them is 0.35 to 3. So optimizing that thyroid, your TSH, here you might be told, oh yeah, you're good, you're normal. But ideally you need that number to at least be below 3. I tend to prefer my numbers, my patients to be around 1.0. Now, it doesn't just stop there though, because remember, that's the hormone your brain sends your thyroid to work, but you're gonna wanna look at the hormones actually coming out of your thyroid. So that's T3 and T4. Your body takes T4 and turns it into T3, and T3 is your actual active thyroid hormone. So it's extremely important. So it's free T3 and free T4 is what you want to look at. So then if that's not optimized, you have to optimize them, right? A lot of people take as medication, they take something called Synthroid, so it's only T4. Now, if you can't convert your T4 into the active form, T3, then you need to do a bit more about it, right? You can actually get T3 as a prescription as well. So I have some patients take both Synthroid and something called Cytomel, or some people choose to be on something called desiccated thyroid, which is also known as natural thyroid. It actually comes from an animal source and it has T4 and T3 in it. Okay, so now you've optimized your TSH, your T3 and T4 look good, but you still don't feel good. So what's going on? The one thing I always ask my thyroid patients, I ask them, do you have Hashimoto's? And most people actually don't know. So Hashimoto's is when the immune system attacks the thyroid. So that's actually the reason that the person has a thyroid issue. It's an autoimmune disorder. So if somebody's positive for this, they have to follow an autoimmune protocol to really feel good. And that always means that you have to fix the gut, right? So anti-TPO and anti-thyroid globulin, super easy to test. It's done, it's a blood draw, so it's super easy to do. And then, yeah, if you have Hashimoto's, then it's a whole different ballpark altogether. Again, with the thyroid, though, there's other stuff that people don't think about. But to make thyroid hormone, you actually need something called iodine. So T4 means that there's 4 iodines, and T3, there's 3 iodines. So if you don't actually have enough iodine in you, you won't be making thyroid hormone. You can actually test your iodine. So people always ask me, should I be taking iodine? And to be honest, you actually don't want to be taking iodine if you don't need to. Iodine can be toxic in high levels, but it is tested. We test it in the urine. So very simple, you give your first morning urine and it will tell you if you have enough iodine. And then from there, you know if you need it and how much you should be taking as well. The urine test usually actually tests also something called selenium. So selenium is a mineral. It's found in a very high concentration in Brazil nuts. It actually helps you activate your thyroid hormone. So to turn that T4 into T3, you actually need selenium. So if you're low in this, then you're not going to be making active thyroid hormone. So you're probably going to feel tired, hair loss, weight gain, that kind of stuff still. Another thing to test for that I encourage my patients is something called bromide. So bromide is a chemical. It's found in a lot in new materials. So if somebody has a new car, couches, new buildings like we're in right now, what happens is, so like I said earlier, the thyroid hormone is made of iodine, so T4, 4 iodines, T3, 3 iodines. But bromide, this chemical, actually kicks off the iodine off the thyroid hormone. So you actually end up, I call it fake thyroid hormone. If you are high in bromide, there is a protocol. It's actually, you are able to get rid of it in the body. So it's something good to find out, really. And then another thing is cadmium. So cadmium is a heavy metal. If it's too high, again, it prevents you from activating your thyroid hormone. So you're not going to be turning that T4 into T3. So very important to test for as well. The only people that I've seen it high in the past has always been people that are on well water. So some people have been high in cadmium. Again, easy to get rid of out of the body, but you need to know first if it's there, right? One thing people don't realize, so I get some people, they come, they're like, listen, I have a thyroid issue. It's come off, it's borderline, but my doctor doesn't want to treat me because it's the first time it's been off. And I always ask, well, have you been through a lot of stress? Have you looked at your adrenal glands? So your stress hormone is called cortisol. And if cortisol gets out of whack, out of balance, it will actually really affect your thyroid. So us as naturopaths, we want to fix the root cause, right? So if the root cause for your thyroid issue is actually your adrenal glands, that's actually a good thing. Because if you can fix your adrenals and manage your stress and manage your cortisol levels, then your thyroid issue will actually be non-existent, which is really, really cool. Last thing that I always get asked about is something called reverse T3. Reverse T3, basically what it means is that your body, instead of activating your T4, so turning your T4 into T3, it turns it into reverse T3. It basically looks like a mismatched T3, basically. And unfortunately, that has the opposite effect on the body. And so again, if you're taking Synthroid and you're turning that T4 into T3, it's going to be useless. You're still going to have all your symptoms of hypothyroidism. So that's kind of my spiel, I guess, on the thyroid. So just to recap, I don't think you should just be testing TSH. I think you should be looking at your free T3 and free T4. I think you should know or find out if you have Hashimoto's. Do you have an autoimmune disorder? Extremely, extremely important. Look for that reverse T3. It's a simple blood work, very easy to do. And then test your iodine, test your selenium, your cadmium, and bromine, and address the root cause and manage your stress. Big, big deal. So that's all I had to talk about. If you have any questions, write them below, and we'll do our best to answer them. Take care. Happy Naturopathic Medicine Week.